Why do some men over 60 still feel vibrant and confident in the bedroom, while others struggle every single time? I'm Dr. Grace Miller, a urologist with over 2 decades of experience. And today, I need to tell you something most doctors won't say out loud. There are specific bedroom mistakes that millions of men make every single day that are quietly destroying their prostate health. And the worst part? Most men have no idea they're doing it. Stay with me, because what I'm about to share could save your prostate, restore your confidence, and completely change how you feel every single day. Here's what I see in my clinic, week after week. Men come in frustrated, embarrassed, and confused. Their prostate is enlarged. Their symptoms are getting worse, and their intimate life has become a source of stress instead of joy. And when I ask them about their daily habits, their bedroom routine, their lifestyle, I start seeing the same patterns over and over again. Small mistakes that seem harmless, but over months and years, they add up, and they're damaging your prostate in ways you never imagined. Before we go any further, I need to know something. If what I just described sounds familiar to you, if you've been struggling with these exact issues, type the number 1 inch the comments right now, just the number 1. But if you're watching this because you want to prevent these problems before they start, type the number 2 inches the comments. Let me know you're here to stay ahead of the game. Either way, your comment helps me understand what you need most. Now here's what makes this so frustrating. These aren't complicated medical issues. They're simple habits, things you're doing right now, that you can change starting today. In the next few minutes, I'm going to walk you through 5 bedroom mistakes that are destroying your prostate health. I'll explain exactly why they're harmful, what the science says, and most importantly, what you can do instead. No shame, no judgment, just honest information that could make a massive difference in your life. Because here's the truth. Your prostate health and your intimate life are deeply connected. When one suffers, the other suffers too. But when you fix these mistakes, both improve together. Let's start with the biggest one. Mistake number 1, complete sexual inactivity. The first mistake is complete sexual inactivity. And this might surprise you. Many men over 60 assume that, as they age, it's normal, even healthy, to just stop being sexually active altogether. Maybe intimacy with a partner has become difficult. Maybe they've lost interest. Maybe they think it doesn't matter anymore. But here's what the research shows. Complete sexual inactivity can actually harm your prostate. A major study following almost 32,000 men over nearly 2 decades found that regular ejaculation, at least 21 times per month, reduced the risk of prostate problems by about 20% compared to men who ejaculated only 4 to 7 times monthly. Why does this happen? Think of your prostate like a gland that produces fluid. When that fluid sits stagnant for long periods, it can become a breeding ground for inflammation. Regular ejaculation helps flush out old fluids, bacteria, and inflammatory compounds that can build up inside the prostate tissue. It's similar to a pipe that never gets used. When water sits still, it stagnates. But when it flows regularly, it stays clean and healthy. Now I want to be very clear about something. I'm not talking just about intercourse with a partner. Sexual activity includes any form of ejaculation, whether with a partner or through self-stimulation. What matters is the regular release and flushing of prostatic fluid. But here's what most men don't know. It's not just about preventing cancer. Regular sexual activity also helps maintain healthy blood flow to the pelvic region, keeps your hormone levels more balanced, and can actually reduce symptoms of BPH, like weak stream and frequent urination. What should you do instead? Maintain some level of regular sexual activity, whatever that looks like for you at this stage of life. Whether it's with a partner or alone, aim for consistency. The research suggests at least several times per week offers the most protective benefits. If physical or medical issues make this difficult, talk to your doctor. There are solutions, medications, and therapies that can help restore function and make sexual activity comfortable again. Mistake number 2, Prolonged sitting, especially in the evening. The second bedroom mistake might seem odd at first, but it's one of the most damaging habits I see. Prolonged sitting, especially in the evening before bed. Let me explain. Prolonged periods of sitting or inactivity can irritate the prostate gland, and one condition called prostatitis, inflammation of the prostate, can be made significantly worse by a sedentary lifestyle. Here's what happens. When you sit for long periods, especially on soft surfaces like couches or recliners, you're putting direct pressure on your prostate gland. That gland sits right below your bladder and above your pelvic floor. Sitting compresses it, reduces blood flow to the area, and can trigger inflammation over time. Research found that men with an extra hour of sedentary time in their day had a 16% greater chance of having elevated prostate-specific antigen levels, a marker of prostate inflammation. Now, here's why this becomes a bedroom issue. Many men spend their evenings sitting for hours, watching television, reading, or just relaxing in a recliner before bed. Then they go straight to the bedroom and wonder why they have no energy, no drive, and why intimacy feels impossible. The prolonged sitting has literally compressed their prostate, reduced blood flow to their pelvic region, and created an inflammatory environment that makes sexual function difficult. What should you do instead? First, limit continuous sitting to 30 to 45 minutes at a time. Get up, move around, stretch, even if it's just for 2 or 3 minutes. This simple habit relieves pressure on your prostate and restores blood flow. Second, avoid sitting on very soft surfaces for extended periods. Firm, supportive seating is better for your prostate than sinking into a soft couch. Third, and this is important, take a 10 to 15-minute walk in the evening before bed. Even gentle movement increases pelvic blood flow, reduces inflammation, and can dramatically improve your comfort and function later that night. Studies even show that for men with prostate issues, urinating in a sitting position improves urodynamic function compared to standing. So don't avoid sitting entirely. Just avoid prolonged, uninterrupted sitting. Mistake number 3, ignoring pelvic floor weakness. The third mistake is something almost no one talks about. Ignoring pelvic floor weakness. Most men don't even know they have a pelvic floor. But you do. It's a group of muscles at the base of your pelvis that support your bladder, bowel, and yes, your prostate. These muscles also play a critical role in sexual function, ejaculation, and urinary control. As men age, especially after 60, the pelvic floor naturally weakens. And when it weakens, several things happen. Your prostate gets less support. Blood flow to the region decreases. Urinary control becomes harder, and sexual function suffers. In my practice, I see men with enlarged prostates who also have severely weak pelvic floors. The combination makes their symptoms much worse. They leak urine, they have weak ejaculation, and they feel embarrassed and defeated. Here's what the science shows. Strengthening your pelvic floor muscles can improve urinary symptoms, enhance sexual function, and even reduce inflammation around the prostate by improving local circulation. What should you do instead? Start doing pelvic floor exercises, also called Kegel exercises. These aren't just for women. Men benefit enormously from them. Here's how to do them correctly. First, identify the right muscles. Next time you urinate, try to stop the flow midstream. The muscles you use to do that are your pelvic floor muscles. Once you've identified them, practice contracting them for 5 seconds, then relaxing for 5 seconds. Do this 10 to 15 times in a row, 3 times per day. You can do them anywhere, sitting, standing, or lying down. No one will know. Within 4 to 6 weeks, most men notice stronger urinary control, better ejaculatory force, and improved sexual confidence. It's one of the simplest, most effective things you can do for your prostate and your bedroom performance. Mistake number 4, using unhealthy lubricants. The fourth mistake is something many men don't think twice about: using unhealthy lubricants during intimate activities. As men age, natural lubrication decreases, both for you and potentially for your partner. So using lubricants becomes more common and often necessary for comfortable intimacy. But here's the problem. Many commercial lubricants contain chemicals, fragrances, preservatives, and additives that can irritate sensitive tissue. And when those chemicals come into contact with your urethra, they can travel up into your prostate, triggering inflammation and discomfort. I've had patients come in with chronic prostatitis, inflammation of the prostate, and when we investigate their habits, we discover they've been using petroleum-based products, scented lotions, or lubricants with glycerin, parabens, or artificial fragrances. These ingredients can disrupt your body's natural pH balance, introduce bacteria into the urinary tract, and cause low-grade chronic inflammation that makes prostate symptoms worse over time. What should you do instead? Choose high-quality, body-safe lubricants. Look for water-based or silicone-based options that are specifically labeled as hypoallergenic, fragrance-free, and paraben-free. Even better, look for lubricants designed for sensitive skin or medical use. These are formulated to match your body's natural pH and won't cause irritation. Avoid anything with artificial fragrances, dyes, warming or cooling sensations, or flavors. Those additives might sound appealing, but they're often the culprits behind irritation and inflammation. And here's a simple rule. If you wouldn't put it inside your body in another context, don't use it for intimate activities. Your prostate will thank you. Mistake number 5. Rushing or forcing intimacy when not ready. The 5th and final mistake is one rooted in pressure and expectation. Rushing or forcing intimacy when your body isn't ready. Here's what I mean. Many men feel pressure to perform, to match what they could do decades ago, or to meet a partner's expectations, so they rush into intimacy even when their body is giving signals that it's not ready. Maybe they're tired, maybe they're stressed, maybe blood flow hasn't fully reached the pelvic region yet. When you force intimacy before your body is physiologically ready, you create physical strain on your prostate and pelvic muscles. Incomplete arousal means reduced blood flow, which means more pressure and friction on the prostate during ejaculation. Over time, this can contribute to inflammation, discomfort, and even pelvic pain. But there's also a psychological component. Anxiety and stress release cortisol, a hormone that suppresses testosterone and worsens inflammation throughout the body, including in the prostate. The result? A vicious cycle where performance anxiety creates physical problems, which create more anxiety, which creates worse physical problems. What should you do instead? Give yourself time. Arousal after 60 often takes longer than it did when you were younger, and that's completely normal. Allow 15 to 20 minutes for your body to fully respond. Focus on relaxation, connection, and pleasure, rather than rushing to a specific outcome. Foreplay isn't optional at this stage of life. It's essential. It increases blood flow to the pelvic region, prepares your prostate for activity, and reduces strain on all the tissues involved. And most importantly, communicate openly with your partner. Let them know what you need, what feels good, and what doesn't. There's no shame in slowing down and adjusting expectations. Intimacy at 60 and beyond can be just as fulfilling. It just looks a little different. Now let's tie all of this together. These 5 bedroom mistakes: complete sexual inactivity, prolonged sitting, ignoring pelvic floor weakness, using unhealthy lubricants, and rushing intimacy, might seem small on their own, but together they create a perfect storm for prostate problems. They reduce blood flow, increase inflammation, weaken supportive muscles, introduce irritants, and create physical and emotional stress, all of which make your prostate more vulnerable to enlargement, infection, and dysfunction. But here's the good news. Every single one of these mistakes is fixable. You don't need expensive treatments. You don't need surgery. You just need awareness and commitment to making small, consistent changes. When you maintain regular sexual activity, move throughout the day, Strengthen your pelvic floor, choose safe products, and give your body the time it needs. You create an environment where your prostate can thrive. And when your prostate is healthy, everything else improves. Your sleep gets better. Your energy returns, your confidence comes back, and your intimate life becomes something you look forward to again, not something you avoid. Let's quickly recap the 5 bedroom mistakes destroying your prostate. Mistake number 1, complete sexual inactivity. Stay active in some form, whether with a partner or alone, to keep your prostate flushed and healthy. Mistake number 2, prolonged sitting, especially in the evening. Get up every 30 to 45 minutes, take evening walks, and avoid extended sitting on soft surfaces. Mistake number 3, ignoring pelvic floor weakness. Start doing Kegel exercises daily to strengthen the muscles that support your prostate and improve function. Mistake number 4, using unhealthy lubricants. Choose body-safe, fragrance-free, water-based, or silicone-based lubricants that won't irritate your prostate. Mistake number 5, rushing or forcing intimacy. Give your body time to respond, focus on arousal and relaxation, and communicate openly with your partner. Fix these 5 mistakes, and you'll see dramatic improvements in your prostate health and your overall quality of life within just a few weeks. Now here's what I want you to do right now. First, smash that like button if this video opened your eyes to something you didn't know before. It helps other men discover this life-changing information. Second, subscribe to this channel and turn on notifications, because I'm releasing powerful content on senior men's health every single week. Real topics that actually matter to your daily life. Third, drop a comment below right now. Tell me, which mistake hit home for you? Which one are you going to fix first? Your comment might help another man realize he's not alone in this struggle. And fourth, share this video with a friend who needs to hear it. Someone you know who's dealing with prostate issues or bedroom struggles. You could change his life by simply hitting the share button. Finally, watch the video appearing on your screen right now. It's called 5 Foods That Are Secretly Making Your Prostate Worse. It connects directly to what we discussed today and gives you even more tools to protect your prostate. Thank you for watching. I'm Dr. Grace Miller, and I'll see you in the next video. Take care of yourself, and remember, small changes create massive results.